So joining us now, Administrator for the Centers for Medicare and Medicaid Services, Dr. Oz, great to see you this morning. Thanks for joining us. So there has been a lot of talk about tightening up Medicaid with things like work requirements, all of this in an effort to get rid of fraud and those who abuse this system. What can you share with us?
Well, the president was very clear. He wants to get rid of the fraud, waste, and abuse because he sees it as a direct attack on our most vulnerable citizens. Because if you steal money from Medicare, which is for older people, or Medicaid, which is for the vulnerable folks who are younger, don't have resources, you're stealing money from people who desperately need and would benefit from health care. So we've gone after it. That sign's a good example. There are no cuts to Medicaid, thankfully. We are increasing expenditures in Medicaid, $200 billion to be specific, but we're not going to throw money away. What happened during COVID is the Democratic Party decided we needed to just put more money into the system and hope it gets spent well. I don't think that's a wise move. You want to spend the money wisely, thoughtfully, insightfully to get the best value for the buck, because healthcare is expensive. The budget of Medicare and Medicaid that I have to administer is about $1.7 trillion. That's twice the defense budget. So if we make a mistake, it costs us billions and billions of dollars. So the one big beautiful bill cleaned it up. It dealt with the fraud, waste, and abuse. We were able to get work requirements into the system, which you mentioned at the outset. And I just want to cover this for a second. Every Democratic president and every Republican president has repeated the belief that you have to have work requirements as part of any social safety net program. If I'm going to give you free health care insurance, I should expect you to try to get a job. I know if you don't get one, it's fine. We'll still cover you. But if you don't even try, if you're sitting at home and not showing up in life, then that's a problem. And on average, an able-bodied individual on Medicaid watches 6.1 hours of television. That's a lot of your show. Plus, they sit around. Right? So we want people, they don't want that, though. They don't want to sit around doing nothing. People want to go out and do what God wanted them to do, which is change the world, help your fellow citizens. So we have a desire to get people engaged in the community. That's now codified in the law, and we're implementing it.
Now, this week, Doc, you're rolling out a new plan, $50 billion to help rural hospitals. Of course, the left says that's to offset the Medicaid cuts, but you actually view this, I've heard you speak about this, as an opportunity for hospitals to make long-term investments and actually improve their health delivery to those communities in need. I mean, how does that work?
Well, put it in perspective, that's a 50% increase in expenditures in rural America. And the reason that Congress and the president wanted this was because rural America is falling behind when it comes to health. 40% of the hospitals are in dire straits financially. Life expectancy in rural America is 3 years shorter than urban America. Your zip code should not dictate your life expectancy. And so we need to fix the problem, but in a sustainable way. The way we think about the world is don't just do a Band-Aid on a hemorrhaging artery, fix the problem. And the issues in rural healthcare revolve around shortage of workforce, inability to use technology that's widely used now in urban America, and we've got a problem with the need to resize the system. So this $50 billion massive infusion over the next 5 years will be given to governors, because we believe governors know more about their states than anybody else and can make some difficult decisions to right-size the system. This, however, is a competition. Not everyone gets the same amount of money. You actually have to write an application, which is due within the next 2 months. We're going to give the money away by the end of the year. Our responsibility is to the American people. So if the application is poor, you're not getting as much money. But ideally, everyone talks to each other. They work with the smartest people in their states. They come up with innovative ideas that will today improve rural health care. But those ideas could tomorrow help us with the rest of the healthcare system as well.
I do want to pivot while we still have you here, because the CDC's Vaccine Advisory Panel is meeting again today, a vote on possibly changing vaccine regulations involving COVID, as well as hepatitis B, the mumps, measles, rubella vaccines as well. What can you share with us? What do you think happens today?
There's a long overdue, honest reflection on what really is being done to our children. What's the right number of vaccines? So a bunch of experts collected in a room working with the CDC are giving guidance to the American people, especially to moms, about what is the best science and what are the best recommendations. My job is to pay for these vaccines. And our desire is to make sure that you have choice as a mom. No more mandates, but no more restrictions either. If you want to get a vaccine in whatever way for your child, we want to make sure that we'll pay for it so that you feel covered. But we want you educated to make the best choice as well, and that has to include your doctor.
All right, Dr. Oz, great to have you with us this morning. Thank you.
Information. Truth is freedom. Is Newsmax. It's real news for real people.